These are the most unexpected signs of cancer that are often overlooked by the majority of people. Cancer is when our body's cells go rogue. Instead of growing and dividing in an orderly way, they start multiplying out of control. These abnormal cells can form tumors and spread to other parts of the body, disrupting how things normally work. There are tons of reasons why this happens. It could be something in our genes, exposure to harmful stuff in our environment, unhealthy habits, or simply getting older. Our immune system, which usually fights off problems, can also get weaker and miss these out-of-control cells. So, the earlier we catch cancer, the better our chances of beating it. Let's talk about those easily missed signs, the ones that might seem like nothing, but could actually be your body trying to tell you something important. Number 1. Unusual lumps. Now, we're not talking about the occasional bump or bruise that comes from everyday life. We're talking about persistent lumps or areas of swelling that appear seemingly out of nowhere and don't go away. These can occur anywhere on your body, under the skin, in your neck, armpits, groin, or even deeper within your abdomen. You see, cancer cells have a habit of multiplying rapidly and uncontrollably. This can lead to the formation of tumors, which can manifest as these unexplained lumps. Sometimes they're small and painless, easily mistaken for a harmless cyst or fatty deposit. Other times they might be tender, firm, or even change in size or shape over time. Let's break this down a bit further. When cancer cells spread from their original site, a process called metastasis, they can travel through the bloodstream or lymphatic system. The lymphatic system is like a network of highways throughout your body with checkpoints called lymph nodes. These nodes filter out harmful substances, including cancer cells. If cancer cells get trapped in a lymph node, they can cause it to swell. So, those seemingly random lumps in your neck or armpit could actually be a sign that cancer is spreading. Now, don't panic. Not every lump or swelling is cancer. There are many benign, non-cancerous causes, like infections, inflammation, or even hormonal changes. But any persistent or unexplained lump should be checked by a doctor. Number 2. Persistent fatigue. If you're experiencing a level of exhaustion that's new, unusual, or interferes with your daily life, it's worth paying attention to. We all get tired sometimes, but the fatigue associated with cancer is often described as a deep, bone-tired exhaustion that doesn't improve with rest. It can make even simple tasks feel overwhelming and significantly impact your quality of life. This isn't just about being a bit sleepy. Cancer can disrupt your body's energy production in several ways. Cancer cells are incredibly energy hungry, stealing resources from healthy cells to fuel their own growth. Its continuous interference with your metabolism and your body's reaction to it create a constant stress that can lead to persistent fatigue and make it difficult for your body to fight off illness or infection. Now, it's not always the case that if you're fatigued, then you'll have cancer, but if it's new, unexplained, and doesn't go away, it's essential to talk to your doctor. It could be a subtle sign that your body is battling something more serious beneath the surface. Number 3. Unexplained weight loss. Sudden, unexplained weight loss might seem like a welcome surprise, especially if you haven't changed your diet or exercise routine. But if you're dropping pounds without trying, it could be your body signaling that something's off. You see, when something disrupts your body's normal processes, like a tumor growing inside you, your body might start burning more calories than usual. Sometimes, the body is working extra hard to fight off an illness or disease, and this can lead to rapid weight loss. So if you notice the pounds dropping off and you can't explain why, don't shrug it off. It's worth getting checked out by a doctor to rule out any serious underlying issues. Number 4. Persistent cough or hoarseness. We all get coughs from time to time, especially during cold and flu season. But if you've had a cough or hoarseness that just won't go away, it's worth paying attention. A cough that lingers for weeks or months could be more than just a leftover from a cold. Sometimes it can be a sign that something's irritating your respiratory system. This could happen if there's a growth or tumor in your lungs or throat that's causing ongoing irritation. But before we share more, don't forget to hit that subscribe button, as knowing these symptoms could potentially save yours or your loved ones' lives. Alright, so hoarseness, or changes in your voice, might also be a clue. If your voice has become rough, raspy, or you've noticed a change in pitch that lasts for a while, it could be due to something pressing on your vocal cords. Again, it's important not to jump to conclusions. Many things can cause a persistent cough or hoarseness, like allergies, infections, or even acid reflux. But if it's not getting better, it's a good idea to talk to your doctor and get it checked out. Number 5. Unexplained bruising or bleeding bruises are a common part of life. Who hasn't bumped into a table and ended up with a purple mark? But if you're noticing bruises that seem to appear out of nowhere or are taking longer than usual to heal, it could be a sign of an underlying issue. This is especially true if you're also experiencing unexplained bleeding from your nose, gums, or other areas. Cancer, particularly types like leukemia, can affect the blood's ability to clot properly. When your body's ability to produce blood platelets is compromised, even minor bumps can lead to significant bruising. You might notice that these bruises take longer to heal or appear in unusual places, like your hands or fingers, where you don't usually get bruises. In some cases, cancer cells interfere with the production of clotting factors, leading to unexplained bleeding from places like your gums, nose, or even in your urine or stool. If this happens, it's your body signaling that something's wrong, and it shouldn't be ignored. Remember, not all bruises or bleeding are due to cancer, but if it's persistent and unexplained, it's a good idea to talk to your doctor. Number 6. Persistent pain. Another common warning sign of cancer is persistent pain. This can take many forms, including headaches, back pain, abdominal pain, and bone pain. Cancer can cause pain in a variety of ways. Tumors can press on nerves, bones, or organs, causing discomfort that doesn't seem to go away. For example, back pain that doesn't improve with rest or treatment might be a sign that something more serious is going on. Some cancers, like bone cancer, can cause pain that feels deep and unrelenting, often worse at night. Other times, pain might be felt in areas far from where the tumor is located, as cancer can send pain signals throughout the body. It's easy to dismiss persistent pain as just part of getting older or a lingering injury, but if it doesn't have an obvious cause, it's worth getting checked out. Number 7. Changes in skin appearance. Your skin is your body's largest organ, and changes in its appearance can be a sign that something is wrong. Unexplained lumps, moles that change size or color, or patches of skin that look different from the rest can all be warning signs of skin cancer or other types of cancer that have spread to the skin. For example, melanoma, a type of skin cancer, often begins as a mole that looks different from the others on your body. It might be larger, have an irregular shape, or be a different color. Other cancers might cause changes in skin texture, such as thickening or rough patches, or even cause wounds that don't heal. These changes might seem minor, especially if they're not causing any pain or discomfort, but they can be important clues that your body is trying to tell you something. Regular skin checks and paying attention to any new or changing marks on your skin can help catch cancer early. Number 8. Difficulty swallowing or persistent indigestion. Occasional indigestion or difficulty swallowing is something most of us have experienced at some point. But if these symptoms persist, they could be more than just a sign of a heavy meal or a sore throat. Cancer of the esophagus, stomach, or throat can cause a narrowing of the passageways, making it difficult to swallow. You might feel like food is getting stuck in your throat or chest, or you might have persistent heartburn or indigestion that doesn't go away with antacids. This isn't just about discomfort, it's about how cancer can interfere with your body's normal processes. As tumors grow, they can block the normal flow of food and liquids, leading to these symptoms. If swallowing has become difficult, or you're dealing with constant indigestion, it's time to see a doctor and find out what's going on. Number 9. Changes in bowel or bladder habits. We don't often think about our bowel or bladder habits, but they can tell us a lot about our health. Changes like diarrhea, constipation, blood in the urine or stool, or a frequent need to urinate could be signs that something is wrong. Colon cancer, for example, might cause changes in your bowel habits, such as a persistent change in the consistency of your stool or the need to go more frequently. Bladder cancer might cause blood in the urine or an increased need to urinate. These symptoms can be easy to dismiss or attribute to something less serious. like a change in diet or a mild infection. But if they persist, it's important to pay attention and talk to a doctor. Your body is trying to tell you that something isn't quite right. Number 10, persistent fever or night sweats. Everyone gets a fever now and then, usually as a sign that your body is fighting off an infection. But if you have a persistent fever or are waking up drenched in sweat night after night, it could be a sign that your body is fighting something more serious. Certain types of cancer, like lymphoma, can cause persistent low-grade fevers that don't seem to have a clear cause. Night sweats, where you wake up soaked even in a cool room, can also be a sign that your body's immune system is trying to battle cancer. So, keep an eye out for these signs. Early detection is your best defense. Don't ignore what your body is telling you. If you found this video helpful, make sure to like, comment, and subscribe to our channel for more important health updates. And stay tuned for our next video to stay informed and proactive about your health.